This is Dr. William Doss. I'm here as part of the University of Miami Osher Center for Integrative Health, and we're going to record a few spots to do acupoints. Dr. Shepley is my motto here, and we're just going to go through a couple things, combination points for low back pain, shoulder, knee, and ankle, and we're also going to do some BFA. So first, let me show you the measurement for Soon. It's the width of my thumb, and that is your measurement that you're going to be using for most of your acupoints. All right. Next, we're going to do Dr. Shepley's back. Dr. Shepley, can you step down for me? All right. The first thing we have are magnets that we're going to use. These are 800 Gauss magnets. So I'm going to open these up if I can. These little. Okay, this is what 800 Gauss. And then this is what they look like. All right, and this is the other side. All right, so one of the first points you can do is Yang Tong Shui. All right, this is in the hand, and this is for acute low back pain. What we're going to do is go between the second and third finger in the inner space, put one there, and then the fourth and fifth inner space, one there. And those will stay, and they will treat as long as they stick. So we're going to go in the second and third inner space and the fourth and fifth inner space of the hand. And we can do that bilaterally. Okay? So this is for low back pain. The next point we're going to do is we're going to do the lumbar area. And these are local points. I'm going to pull up Dr. Shepley's shirt here. Okay? And the first thing we're going to do is obviously pull this up. And we're going to find the iliac crest. So we're going to find the iliac crest on each side. All right, and then we draw a line horizontally across, and that level is the level of L4, the iliac crest. So to put our magnets, we're going to go just above L4 and find our spot in the midline. This point is called do 4. All right, now we're going to take our Soon and measure it 1 and then another half over, and that point is called urinary bladder 23. Okay, now and that's the inner back shoe point. We're going to go another Soon and a half over, and this is the outer back shoe point, and that's urinary bladder 52. Remember, we said 29 points between 23 and 52. All right, now as we go down the inner back shoe point, we're now going to hit going down in the urinary bladder meridian at the level of around the SI joint, which is right about here. This is urinary bladder 26. Okay, so again, let's review. Do 4 at just above the L4 spinous process, urinary bladder 23, urinary bladder 26, and urinary bladder 52 rather, and urinary bladder 26. So do 4, urinary bladder 23, urinary bladder 52, and urinary bladder 26. And then we turn around, and we're going to look at Yang Tong Shui, which is in the hand, and it's right here. Okay, and that's those are 2 points there for low back pain. Okay, all right. Next, we're going to go to the shoulder. Okay, and we won't stick them all the way through, but we're going to feel the shoulder here, and you should feel some depressions there. Okay, so before we go to the shoulder, we're going to go to the hand, and remember the other part of the hand that we're going to go is large intestine 4 is kind of the foundation for all of the points. So this is right here in the first interosseous space on the dorsum of the hand. Okay, large intestine 4. Now we go to the shoulder. Okay, we go to the anterior shoulder. I'll roll this up a little bit. And you're going to feel a depression there, just in front of the deltoid. That's going to be large intestine 15. And we're going to put our magnet there. And we're doing magnets here because as a physiatrist, unless you have formal acupuncture training, these you can use without having any significant hospital privileges. If you do acupuncture, you need a whole set of training that you need to do, and you have privileges for that. So this is large intestine 15. Posteriorly, now we go to Sanjiao 14. This is the Sanjiao meridian, also called a triple burner. and that goes on the posterior shoulder in a depression just posterior to the posterior deltoid. All right. Now, the other point that you can do for the shoulder is called Jin Quan. Okay, and that is between large intestine 15 and the axillary crease, which is right here. And so we put it there. Okay, so that's for your shoulder pain. Now we're going to have Dr. Shepley go ahead and sit down for me. And there's one other point that we can do for the shoulder. And that point is, as Dr. Shepley has his Star Wars socks on. Very good, relax. Okay, so this point here is one of the points for stomach 35. And that lies right in, we'll get to this point later on, but I'm using this point as a reference for where you put another magnet for stomach 38. So this is at the lateral depression of the patella, and then we go 8 soon down. 1, 2, 3, 4, 5, 6, 7, 8. And then we just go lateral to the tibia. And in that depression, this is stomach 38. This is an excellent point for the shoulder as well. So again, your shoulder points are, okay, large intestine 4. We talked about large intestine 15, Sanjiao 14, Jin Quan, which is right in here, and then stomach 38. Okay, now we're going to go to the knees. I'm going to swing around here. And these are all local points that we're going to do for the knees. So I'm going to get my magnets together. Again, we're doing the magnets. Once you have acupuncture training, you can actually use the needles for this area. But for acupressure, which is non-invasive, we can use the magnets, and they are almost as effective as the needles themselves. All right, so now we're going to go to the patella. This is kind of where everything is localized. So first thing we're going to do is we want to go to the depressions on the lateral areas of the patella ligament. So laterally, that's stomach 35. And also medially, that's stomach 35. This is one of the few acupoints that has representation on both sides and has 2 points involved. Okay, so stomach 35. Now, we go to the patella again, and we go to the lateral edge of the patella. So this is stomach 35. We're going to go above the patella. We're going to go too soon. So one thumb breath, and then we go another thumb breath, and that's stomach 34. Now we go to the medial patella, and just, again, the medial edge of patella, and we go too soon above that. So 1, 2, and that point is called spleen 10. So if you notice, stomach, okay, let me reverse that. I'm sorry about that. All right, so this is stomach 35. Medially, this is spleen 10, and laterally, this is stomach 34. So again, I made a mistake here. Stomach 35 is both these points on a medial and lateral patella, just inferior. Stomach 34 is too soon above the lateral edge of the patella. Spleen 10 is on the medial edge of the patella, too soon above. So these points, stomach 34 and spleen 10, lie directly across from each other. Again, spleen is the medial meridian, and the stomach is the lateral meridian, except for this point here, which is stomach 35. Okay? All right, we're done with those points now. And the next thing we're going to do is our BFA. We're not going to demonstrate BFA on this gentleman here because it can be a little painful. But this is the needle that we use. This is a spring-loaded needle. This is gold. Okay. The other option that we have for those patients who can't tolerate the needle are seeds. So these are the seeds that we use. And this is what they look like here. And we just can peel them off. Usually we have tweezers that you can peel them off with. Don't have tweezers here, but we'll give you a little demonstration here. We just peel them off. And that's what they look like right there. Okay, very good. All right, now, the BFA points that we're going to demonstrate, again, we're not going to physically put them in, but we're just going to show them where to go. All right, so these are where our BFA points are. So the first one we're going to do is called the cingulate gyrus. And here's the tragus. This is the antitragus. And down here is our first point. That's going to be the cingulate gyrus point. Okay, just below the intertracheal notch. That's C of C-tops. The next point we're going to do is the peak of the antitragus, which is right at the top here. That point is called the thalamus. The thalamus, that point is right there. Next point is going to be the anterior third of the helix, which is omega 2, which is right up there. And that's O for C-top. So C-T-O. Next point is called point 0. Now you go to the helixus crus, which is right in here, and you go, there's a little indentation that you'll feel, and we go right there. And that's where the helix, that's where the point 0 goes. So again, that's C-T-O point 0, which is P. The last one is Shin Men. And this is in the triangular fossa here. And this is his right ear. And remember, we talked about this being either Oregon and Washington on the right ear, Maine on the left ear. So we're going to go right to this point here, and this is a point for anxiety, as well as used for other things besides BFA. Okay, so that's C-tops. All right. Now, Dr. Shepley is going to turn back around, and the last thing we're going to do is the plantar fasciitis treatment. All right. So we have our leg here. Okay. What we're going to do is we're going to go from the lateral tibial plateau to the lateral malleolus, and we're going to divide this into thirds. Okay. And just going to mark this area here. Okay. That's our little area there. And then what we're going to do is the needle we're going to use is a 100-millimeter needle. It's pretty long. All right. And we're going to go in between the tibial and the fibula. We're going to insert this needle here, and we're going to advance it all the way kind of transverse in between the interosseous membrane. And then at the same time, we're going to tell the patient, ask them what they're feeling. Once they start feeling tingling or electrical sensation in the bottom of the foot, then we're going to stop advancing the needle, and then we're going to hold it. Okay, again, the needle, pretend the needle's inside. All right, and then from there, what we're going to do is we're going to massage the needle back and forth like this. Okay, for about 90 to 120 seconds, so anywhere from 1.5 minutes to 2 minutes. And that patient should feel the numbness and tingling in the bottom of the foot, electrical sensation, and then after 2 minutes, we will draw the needle and draw it out, and then control any bleeding if this locally that may be there. And then that patient should get excellent relief. Okay? So again, let's review. We have the plantar fasciitis treatment here. Work our way up. This is the knee treatment here. Okay? We have the shoulder treatment here, and the low back treatment in the hand, as well as the lumbar area. This is Dr. William Doss. I'd like to thank Dr. Shipley, as well as my nurse, Ms. Busby. Thank you very much, and enjoy your acupuncture course.